Hey guys, so a great question came in the total knee replacement support group for kind people on Facebook. This is a question we've talked about a lot on this channel, but specifically, so when were you able to start driving? I'm concerned about pressing the wrong pedal because my leg feels so heavy. So this is definitely a question for your surgeon. There are some surgeons that have very strict or stringent guidelines on when you're allowed to return to driving. There are therapists, OTs and PTs, who specialize in return to driving for individuals who have had various kinds of injuries, but also a total knee replacement surgery. I can tell you as a general rule of thumb, depending on where you live here in the US, if you had surgery on the left total knee, you usually can return to driving sooner than if you had it on the right. But a lot of the surgeons here locally will say that as long as you're off the narcotics and as long as you're on either a cane or no assistive device for walking, you should be safe to return to driving. Most surgeons will allow you, the patient, to make that determination. You have to feel comfortable, you have to feel confident. But a general rule of thumb, some surgeons say 6 weeks is the guideline. I've seen patients who are driving in 1 week. I've seen patients who are still using a walker and not driving after 12 weeks. So talk to your surgical team, talk to your physical therapist. If you're not feeling confident in your ability to control the pedals, then absolutely it's not time to return to driving yet.